Hello guys, welcome to our new video. Today's subject is mechanism of angiotensin converting enzyme inhibitors induced cough. Possible mediators that play a role in development of cough are bradykinin and substances P, which are destroyed by angiotensin converting enzyme. Use of angiotensin converting enzyme inhibitors inhibit action of angiotensin converting enzyme and that cause accumulation of bradykinin and substance P in upper and lower respiratory tract that may lead to produce cough. Angiotensin converting enzyme inhibitors are categorized into three groups based on presence of sulfhydryl, carboxyl or phosphoryl group. Many clinical studies reveal that phosphoryl group containing angiotensin converting enzyme inhibitors such as fosinopril were associated with a higher incidence of cough compared with carboxyl group containing ACE inhibitors like enalapril, lisinopril and ramipril. In conclusion, cough produced as a result of side effect of angiotensin converting enzyme inhibitors may be temporary, lasting a few days to weeks. However, if the side effect lasts longer than that, bother you or becomes severe, be sure to talk with your doctor or pharmacist.